Okay, let's just get right into it. What if I told you that recovering from a major heart procedure wasn't this months-long marathon you might be picturing? What if it was more like a 30-day sprint? And I'm not talking about some far-off future idea. This is a revolutionary new approach, and it's happening right now.
I know, it sounds almost too good to be true, right? But this is a totally science-backed journey. The whole idea is to focus on the most vital phase of your healing and pack it into one single, super-structured month. So let's break down what this new timeline actually looks like.
And to really get a grip on just how big of a deal this is, we've got to take a quick look back at how things used to be done. I mean, for decades, patients were told to expect this long, uncertain road. The common thinking was, okay, you're in for a slow recovery, 2, 3, maybe even more months. And you can imagine, that wasn't just stressful. All that waiting around came with a ton of anxiety and, honestly, a higher risk of things going wrong.
But that whole model is changing. Now, let's be clear. The goal isn't to be 100% healed in 30 days. That's not realistic. The new focus is all about an intensely managed first month. That first month is the foundation for long-term success. It's what dramatically cuts the risk of being readmitted to the hospital and gets you back to your life faster and safer than ever before.
Okay, so what does this 30-day sprint actually look like in the real world? This isn't just theory, you know? We're talking about a detailed plan that top hospitals are using with patients right now.
So let's look at a great example. UW-Medicine's Heart Institute. They are really pioneering these 30-day timelines for minimally invasive procedures, like TAVR. You know, that's transcatheter aortic valve replacement. And what they've done is map out a super clear blueprint for success.
And what's so cool about this is how it lays out the whole journey. It's not just go home and rest anymore. The moment you're discharged, you have a concrete plan. A few days later, a nurse is calling to check in on you. Then, at that 30-day mark, you have that crucial in-person visit with tests like an echocardiogram to see exactly how your new valve is performing. And then by 6 weeks, you're confidently transitioning back to your regular cardiologist. It really is a blueprint for empowerment.
Right, so this whole revolution isn't just happening in a vacuum. It's all being driven by the absolute latest, practice-changing science from some of the most respected names in the entire field of cardiology. We are talking about the brand new 2025 guidelines from the American College of Cardiology and the American Heart Association. And listen, these aren't just suggestions. They are the new standard of care. Let's dig into 2 specific changes that really make this 30-day model work.
Okay, first things first, we need to quickly define a key term you're about to see, which is DAPT. That stands for dual antiplatelet therapy. The easiest way to think about it is like a 1-2 punch of blood-thinning meds. Their whole job is to stop dangerous clots from forming on new stents or valves.
And here, this is the real game changer. The old standard, back from 2016, was to keep patients on these pretty powerful drugs for an entire year. So the new 2025 guideline, it recommends stepping down to just a single drug after only 1 month. This is huge. It dramatically reduces the long-term risk of bleeding complications and just simplifies the whole recovery process.
All right, the second major shift is all about tackling the root cause of the problem, cholesterol, and doing it with a whole new sense of urgency. The goal here is to protect the heart for the long haul, and that work now starts right away, from day 1.
Yeah, this graphic straight from the guidelines really tells the whole story. It used to be that doctors would kind of wait and see if statins alone would do the trick. Not anymore. Now, the second a patient's LDL cholesterol is still above 70, the guideline is clear. Immediately add a second, non-statin drug. It's a much more proactive strategy designed to get that cholesterol down way, way faster.
So you can think of that first 30-day sprint as the launch pad. It's crucial, but the ultimate goal, of course, is lifelong health. And to get there, you need a dedicated support system that kicks in right after that first month is over.
And the guidelines are super explicit about this. They literally say that after you go home, focusing on preventing another event is fundamental. And what's one of the most powerful tools to do that? A referral to cardiac rehabilitation.
So what exactly is cardiac rehab? Well, it's a really comprehensive, medically supervised program that goes way beyond just exercise. Think of it as a holistic approach. It combines professional nutritional guidance, psychosocial support for stress, and all the education you need to help you build back not just your physical strength, but your confidence too. So when you put all of these pieces together, you've got the structured 30-day plan, the new science-backed guidelines, and that long-term support from cardiac rehab. What you get is a completely new picture of what recovery looks like today.
The main takeaway here is pretty clear, right? We are moving away from that old model of just passively waiting to get better. Now we're in an era of active, empowered recovery. And this whole journey, because it's guided by science, provides a clear path that isn't just faster, it is fundamentally safer.
Look, this 30-day revolution is so much more than just a new timeline. It's really a whole new mindset. And it leaves us with a pretty exciting question to think about. Now that we're mastering this initial phase of healing, what other incredible breakthroughs are waiting for us just over the horizon in the world of heart health?